I'm Elif Ayvalı, and this work is part of a big collaboration on complementary situational awareness for minimally invasive surgery. This work is motivated by two main challenges in robotic surgery. The first challenge is that there is no direct access to the surgical site, so the surgeon can no longer use the sense of touch to explore the environment. The second challenge is that there is a restricted visual field which results in a loss of spatial awareness and makes surgical navigation in general more difficult. Previous work has shown that if we have a robot equipped with force and position sensing, we can perform mechanical palpation to obtain a stiffness map of the organ. This stiffness map tells us the location of important features, such as arteries and cancerous lumps, which are stiffer than the surrounding tissue. Our group has previously shown that we can also use mechanical palpation to register a surgical tool to a preoperative model of the environment. This helps us regain some of the lost spatial awareness. This work is different than any of the previous work in that we use the sensory information collected during mechanical palpation to predict where these important anatomical features are, and then we use this information as prediction to guide the robot. This framework is based on Bayesian optimization. Here is a 1D illustrative example. Initially, we don't know the quantitative value of the stiffness distribution, but we know that the features we are interested in finding, such as cancerous lumps, correspond to a local or global maxima of this unknown stiffness function. So this is a perfect problem for Bayesian optimization. We probe the organ at several locations and perform Gaussian process regression to predict the mean and the variance of the stiffness distribution. Then in Bayesian optimization, we define a utility function which takes in the mean and the variance of the Gaussian process and tells us where we should go next to gain maximum information that will reduce uncertainty and narrow down the search to a maximum. Here are two examples that shows the performance of the Bayesian optimization. The figures on the left show ground truth stiffness map. The figures on the right shows Bayesian optimization guided exploration and the predicted stiffness map. This video illustrates the full framework. We use Bayesian optimization to tell the robot where it should go next to gain maximum information, and we use registration to overlay the predicted stiffness map onto a preoperative model of the environment. Therefore, we help the surgeon regain some of the lost haptic awareness and the lost spatial awareness. This work was funded by National Robotics Initiative.